Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Oh, Hallie.
Hey, Dr. Luper. How's it going?
Good. It's going really good.
Good.
So I want to talk about Raynaud's phenomenon, or Raynaud's syndrome, Raynaud's disease. It's called lots of different things. There's some variations on that, but the thing about it is, well, you have it.
I mean, I've been really curious, more so this winter than ever before, on the circulatory system and what happens to it when it goes bad. And so the experience I'm having that's bringing all of this to light is whenever I go skiing, doesn't matter how warm it is. We've had a freakishly warm winter this season, and it doesn't matter what type of gloves I wear, how warm it is. For the first 20 to 30 minutes, I have excruciating, neuropathic pain in my fingertips. And it feels like it's been shut in a door or somebody slashed a hammer on it, and it stays feeling like that for about 30 minutes of my ski, 20 minutes of my ski. There will be a point to where it starts to warm up, but for the first 20 to 30 minutes, it's the most pain I've ever felt.
Yeah.
And so, in kind of talking to you about it and doing my own research, I wound up on Raynaud's phenomenon.
Yep.
Am I saying that right?
Yeah.
Okay.
Raynaud's is how I was taught to say it. It's a French name, probably some guy, some French doctor. I'm not sure where the name came from. But the symptoms you're describing are classic. It's painful. What's causing it is a decrease in blood flow to your hands, your fingertips in particular. And since there's not enough blood coming to your fingertips, they get ischemic. They don't have enough oxygen to be able to live the way they need to live and do the things they need to do and, heal and do all that kind of stuff. And so the nerves suffer. The nerves are complaining. The nerves are telling you something is wrong, and something is absolutely wrong. So it's a blood flow problem. It's a better way to say it, though. It's a blood flow reflex problem. So all of us have a reflex in us that if we get cold, our body cuts off or decreases blood flow to our extremities, concentrated on pulling or keeping the blood in the core where it's needed to run organs and keep your body temperature up and so on and so forth. And so everyone has this to some extent. What happens with people with Raynaud's is it's exaggerated. The normal reflex we have is much, much stronger. In fact, it can be strong enough that it literally cuts blood flow off to your fingers and your hands. It could be your feet as well.
Yeah.
And to the point where the ends of the fingers begin to break down. Okay. I've seen it bad enough to where the skin, it's not enough blood flow to actually grow the skin. And so the skin breaks down and you have a little ulcer.
Yeah.
Also where the nails won't grow correctly. And so the nails become rounded in a weird way and shorten. Yeah, possibly. And also where the fingers themselves become shortened.
Oh.
Literally, your body will reabsorb the tips of your fingers, and your fingers will shorten down, and you'll have nubby fingers because of this. It could be that bad to cause that much damage to your actual hands.
So what causes this?
So it's a good question. No one knows exactly. Now, I've already told you what causes it. Each one of us have a reflex.
Yeah.
That's normal, and it's appropriate for our body to hold heat in our core until the core is plenty hot, and then it sends blood back out into our limbs. That's kind of what you're getting. If you ski hard enough, or you run hard enough, or you do whatever outside hard enough, eventually you get enough heat built up in your core that it overcomes this reflex to cut blood flow to your hands, and so the blood will flow back to your hands and you feel good.
And so my body is noticing that reflex even if I'm layered, even if I have, a fleece and
Yeah.
my base layers and my coat, and I'm warm. I
Yes.
feel toasty.
Yes.
But the minute I go outside, my body is like, no, we need to retain this heat to
Yes.
the center.
Yeah, because it's the cold on your face.
Mm-hmm.
Or the cold on whatever little bits of you that kind of come in through the cracks. That's enough to trigger the reflex. It is absolutely a reflex, is what it is. It doesn't even need to be hardly cold for this to happen. Some people will get this, and they live in warm places.
Yeah.
The worst case I ever saw was a patient who lived in Mesa, Arizona.
Wow.
And it's just relative cold, right? You get 70 degrees and it'll trigger this thing.
So why are some people's reflex stronger than others, or why do they?
Yeah, that's a good question. Here's the thing. I have a theory about this. The Dr. Luper theory is that people's immune systems have got their nervous system irritated, and it's an immune system problem. I think the immune system is releasing chemicals. These are the white blood cells that constitute your immune system, are releasing chemicals that are causing the nervous system to become testy and jumpy and reflexy.
And overreactive.
Yeah, exactly, overreactive. Now, I'm not the only one who thinks this, because people with Raynaud's a lot of times have immune system problems. They have autoimmune diseases. Rheumatoid arthritis is the one that's famous, has Raynaud's that goes along with it. So does lupus. That's a classic autoimmune disease.
What about for somebody healthy who does not have an autoimmune disorder?
Just because you have Raynaud's doesn't mean you have an autoimmune disease.
Okay.
So let's be clear about
Okay.
that. Not everybody with Raynaud's, I know where you're thinking.
Yeah. Like, wait a second.
Not everybody has Raynaud's as an autoimmune disease. But if somebody does show up in my practice with Raynaud's, I do, as a matter of course, check them for autoimmune disease. I'll run labs. I'll run inflammatory labs, depending on what their symptoms are. If the C-reactive protein, that's a kind of a good way to get a sense whether the immune system is overreactive, is elevated. It makes me more likely to run other specialty tests,
Or
a lupus panel or an RA panel, a rheumatoid arthritis panel, in other words, or whatever the panel is I'm looking for. And so people with irritated immune systems already are more likely to have this problem. But it doesn't occur with everybody with immune system problems. There's a famous disease called Berger's disease. And Berger's disease is where the blood flow cuts down enough that it really does damage people's hands or their feet. And Berger's disease is caused by, nobody's actually know exactly what causes it, but it's associated with cigarette smoke. And people who smoke cigarettes, some of them will get this. And basically the treatment is to quit smoking. So what we're looking at there is there's an element to cigarette smoke that's a vasoconstrictor, and that's nicotine. So nicotine in and of itself.
Nicotine alone, without the carcinogen, without the smoke,
Yep.
even doing oral.
Yep, that's right. Doing that little gum or something like
Yeah.
that'll trigger it.
Huh.
For sure. Yeah. So will coffee.
Okay, yeah.
So coffee is also a vasoconstrictor. Caffeine, not
Yeah.
coffee, but caffeine is a vasoconstrictor. So if you get enough a dose of caffeine, it can also trigger Raynaud's also. Okay?
Okay, so once Raynaud's is triggered, is it reversible?
Yes and no. It's if you read it, if you look it up in a book or look it up online and say, is it treatable? And the answer is it's treatable, but it's not curable. Which is, I don't know, are we splitting hairs here? Because nearly everyone who's ever had Raynaud's that come see me, they're all better. They're all functional. There's
They don't
ways,
have episodes as
there's
frequently?
ways there's ways to treat people to retrain them to where they don't get this problem.
Okay.
Absolutely. I'm going to say that. Absolutely, because I would do it routinely. So we do this all the time. Now, let me talk slow on this one because I want to make sure it comes through clear. What you're going to need to do to treat Raynaud's is several things. You need to calm down someone's nervous system so that they don't have this itchy, this hair trigger reflex. So we just basically want to have people take things and do things that are naturally calming to the immune system. Okay. Next, we want to do things that are calming, not into the nervous system. Next, we want to do things that are calming to the immune system. Because the immune system a lot of times is the source of whatever's irritating the nervous system.
Okay.
Okay? And then the final thing we want to do is we want to retrain the nervous system to dilate the blood vessels when you get to cold, not constrict blood vessels. This is, in fact, doable. I realize we all have this reflex that causes blood vessels to constrict when we get exposed to cold, but if you do enough practice, you can literally get your blood vessels to dilate when they get exposed to cold. I kind of want to start with that one.
That one seems like miracle work.
It's not. It's easy.
So
It's a super easy thing to do. Now, this is interesting because if you look in the book on Raynaud's, they tell you first thing, don't get exposed to cold. That's the number one treatment.
That's what I saw online when I was looking up, the condition and treatments. It says, well, avoid cold temperatures. And here we are in Fairbanks, Alaska.
I know.
Where it's
Good luck with that.
quite difficult to do so.
So anyways, how you treat this is you get 2 buckets of water. You get one you put hot water in and one you put cold water in. And you put your hands in the hot water and take them out, and you put them in the cold water and take them out. And you go back and forth and back and forth and back and forth.
And how long do you leave in each bucket?
Yeah, good question. Not long, because you want the hot water to be pretty hot, around 130 degrees. Not enough to burn you, but definitely like, woohoo, that's hot, right? And you want the cold to be super cold, and this will absolutely trigger a reaction with people with Raynaud's, without a doubt.
So they will feel
They will
that.
get the reaction. But if you do it correctly, within a few minutes, you're going to train them out of that reaction, and their hands will actually end up warmer.
Okay.
So bear with me on how you do this thing. So you got a pot or a bucket that's too hot, 130. You stick it in, woo, that's hot. And then you put it in the cold water. Oh, this is too cold. This is like, ice water.
Yeah.
Water with hunks of ice in it. Comes back out, and now you stick it back in the hot water, but you could stay in the hot water a little bit longer because you were just in the cold water and your hands were cold. And now, whoa, we got to get out of that one because we're extra hot. And we get back in the cold, and each time you do it, you can stand it a little bit longer. And also, you're carrying a teeny bit of the hot into the cold.
And the cold into the hot.
And the cold
so
into the
you're
hot as you're going back and forth.
increasing
So here's the
temperature.
hot and here's the cold, and as you go along, they tend to move in closer together as in temperature, and it gets easier to leave them in either side longer.
Yep.
Okay? Now here's the reason why it works. When your hands go into the hot is a natural dilator, and so the hands, the blood vessels dilate. And you can tell this because when you bring them out, they're red. Red is blood.
Yep.
So the blood vessels dilated. Now you put them in the cold, and that's a natural constrictor. And so you pull them out, and they're white because they've just been constricted. Then you put them back in the hot, and they open up. And you put them in the cold, and they constrict. And you put them in the hot, and they open up. And they constrict, and they open up. This is analogous to fixing a rusty gate by going, You are literally going back and forth and working the reflex.
Sure.
You're opening and closing and opening and closing and opening and closing. Now, here's the trick. The trick is every time you've come out of the cold, you've moved it over to the hot. So you went from constricted to dilated. That is where it opens up. So the last thing you do is you put your hands in the cold water, and then you bring them out, and they dilate.
By themselves.
Yeah, because
So the last round.
You've done it 30 times in a row, and it just has a momentum on its own.
So you want to end in the cold bucket.
End in the cold bucket. Now that goes against common sense because you want to be warm when you're done. So you want to put it in the warm. No, wrong. You're thinking the wrong way. What you want to do is you want your body to open up of its own accord.
Right.
The trick is overcoming the reflex.
Training
you
your
stick
body.
it in the cold and it dilates. And there it is. You can do it. It works. It really does. It
How
absolutely
long
works.
would you suggest somebody to do that type of treatment?
About 5 minutes.
Long term, like every day for like 2 weeks.
Good question. So how much do you need to do it? You want to get it enough to work? I'd say every day for a week. That's
Okay.
usually all it takes. Once a day for a week. That's a goodly amount to do it. If you're a tough case and you really want to push it hard, twice a day for a week, maybe 2 weeks. Now that's really pushing it. If for some reason it hasn't turned, you're doing it twice a day for 2 weeks and you still get cold going out, something else is going on here. There's a complicated case. I can't even think of anybody that ever was that bad that happened on. Seriously, every single patient I've ever had do this always had to work.
Okay.
It's mechanical.
Right.
It's not tricky.
Sure.
Remember, open, close, open, close,
Right.
open, close. And then open.
Okay. Okay.
And they heat right up.
And so this has worked for most all patients.
Yeah,
if
now this is
all.
not the only thing I'm going to do, because this is not the cure for
What's happening
autoimmune
in
disease,
the immune
right?
system that's really taking care of kind of the nervous system aspect of it, but then there's the immune system piece.
Yeah, so you really need to treat the autoimmune part of this thing. That's an important part of this as well. And so we've done shows on this, and we're going to do shows on this, so we're going to say more about this later. So I'm not going to dive super deep into the details of this, because if anybody's interested in how to treat autoimmune disease, just hang out, watch more of these videos that we're doing, and you'll get some more of the detail about it. But what we want to do generally is calm the immune system down and make it less reactive. And so what you're going to do is, the main thing is you're going to find the source of infection, typically, that keeps the immune system jacked up to begin with. And it could be, anywhere that it's hidden, any kind of hidden infection. You think of all the hidden places in your body.
And there's so many nooks and crannies.
Yeah, I mean, usually it's not, your ear. It could be. It could be, but it's almost never.
You would have a symptom, though.
What it mostly is, it turns out to be your digestive system.
Right, your gut.
Because that's where most people have hidden infections, is in their gut. Could be your sinuses. I've seen that before a fair number of times. Vaginitis has come up occasionally as an uncommon but possible place where you get an infection. So what we need to do is we need to search for and find the infections, because a lot of times it's more than one, and then clear those up with some sort of treatment. Antibiotics you think would work, but they really don't, because antibiotics are very, very good about knocking infections down and clearing them up.
Clearing the entire gut.
And they grow back with vigorosity when you're done with the infection. So it doesn't really work. It'll knock the infections down, but it won't keep them down. So in order to keep them down, you need to change the environment of the digestive system.
Grow the good stuff.
Yeah, you need to change it in such a way that you grow good bacteria and you inhibit bad bacteria. And there's things you can take, mostly herbs, chia seeds, stuff like that. We can go into the details of all that more later, but I'm just getting the big principle. The big principle is to calm the immune system down. Number one is find the infections, treat them, and prevent them from coming back. Mm-hmm. Number two is take stuff that actually calms the immune system down. And also, if we could do it at the same time, things that improve circulation. So if we get the blood to flow better, that way, even if there is a reflex of constriction of the blood vessels, more blood will squeeze through those constrictions. One of the ways we can do that is we can have people take fish oil. Mm-hmm. Fish oil is a decent immune system calmer. It's not the best ever, but it's okay. It's affordable. That's the nice thing about it. It's good for your skin. Mm-hmm. It's good for your brain. It's good for your blood. You're good for your hair. Good for a zillion things, right? Uh-huh. So there's all these side benefits of how it works, and it thins your blood slightly. And so I would do that. That's one of the things I would do. The other thing I would do is I would do something that causes blood vessels to not squinch down so tight. Some kind of natural vasodilator or a blocker of the mechanism that causes blood vessels to squinch down. Now, how blood vessels, what triggers it is calcium. So calcium flows through the calcium channels, and then the blood vessels constrict, the nerves fire, the blood vessels constrict. So if you can use a calcium channel blocker, that's the kind of the classic way to treat this. If you go to a regular doctor and you're looking for a drug treatment for Raynaud's, what they'll do is they'll put you on a calcium channel blocker.
Does that inhibit the body's need for calcium? Like, we need that as a mineral.
Yeah, it doesn't really change the body's need for calcium. It's the same as it was before. It just changes on a local level how the calcium flows through the calcium channels, and then that will prevent the blood vessels from constricting. Now, Kate, what you're really kind of getting at is, is there any side effect to this?
Yeah.
You bet there is.
Yeah.
Yeah, because the body needs to constrict blood vessels to manage your blood pressure. Uh-huh. So people on calcium channel blockers usually have low blood pressure. Oh. So if you have natural low blood pressure and you have Raynaud's, you're in a big hurt because the normal things don't work.
Yeah, well, I do.
There you go. Then you're in trouble because you can't take the normal stuff. Because the normal stuff that's going to inhibit vasoconstriction is also inhibiting squeezing blood from your feet to make it go to your head. Yeah. So you stand up and you get dizzy. That's one of the side effects of the medications.
Would the herbs that you would suggest to patients have the same effect or similar effect?
Maybe. That's actually a really good question. So the herbs aren't as strong.
Right.
And so then you think, well, they're not as strong. We should use the strong stuff. Yeah, except for the strong stuff's got all these side effects that goes with it. Can we use something less strong? Yes, we can.
Okay, something in the middle.
And it's not just herbs. There's a number of things that we can do that'll decrease the intensity of this reflex. Just kind of dial it down. We don't want to shut it down. You know, it's there for a reason, right? We just
Right.
want to dial it down.
Yeah.
So one of the things that's a natural calcium channel blocker is magnesium.
Oh.
Now, it will lower your blood pressure, but not as much as the medications that are calcium channel blockers. So it's kind of a weak calcium channel blocker, which might be exactly what we need.
Mm-hmm.
We don't want a strong one. We want a weak one. Now, if you want a strong one and you're willing to suffer the side effects, let me give you an example. Let's say you have high blood pressure and you have Raynaud's at the same time. Boy, that's a match made in heaven.
Yeah.
Because those people do really well on calcium channel blockers. We should put one on, have them take it, right? But not everybody does. So there's that. Some people are good for it. Some people aren't good for it. So magnesium is a natural calcium channel blocker. Actually, we skipped something. I was talking about things that calm the immune system down. There's a bunch more stuff. I mentioned fish oil. That's
Fish
a weak
oil.
one.
Yeah.
There's way more stuff than that.
What about the herbs?
Yeah, there's all kinds of stuff. In fact, I got a list here so I wouldn't forget anything. Okay, what we got is arginine.
Okay.
Arginine is I'm sorry, I had to look at the whole list and kind of sort it. I don't forget everything on the list here. Let me pick arginine because it's a stronger one. Arginine is a vasodilator, and what it does is it helps with nitrous oxide production. Nitrous oxide is a natural vasodilator. It's the reason why Viagra works, because Viagra makes nitrous oxide increase, and you get more nitrous oxide, and then you get vasodilation, and that's actually how erections work. They work on the same system. So the same stuff that would work on having people with ED, treating ED, actually has some crossover to help people with Raynaud's.
What about yohimbe?
Yes, the answer is yes. Yes,
Wonderful.
it is. Yeah. So that's another thing that's possible.
Yeah.
So arginine I like. It's got less side effects, less chance of having blood pressure problems and those kinds of side effects things with it. And it's decent. It works pretty good. And we could use it not only to treat Raynaud's, we could also use it to treat ED. Again, we have somebody who has ED and Raynaud's at the same time. That's fabulous. Two birds with one stone kind of thing. There's other oils that are helpful. Evening primrose oil is particularly helpful. Probably actually better than fish oil. It's more anti-inflammatory.
What oil?
Evening primrose oil.
Okay.
Evening primrose is a plant.
Okay.
And what they do is they squeeze the oil out of this plant.
Yeah.
And so
you said it kind of fast. So
evening primrose oil. EPO.
EPO.
There's also vitamins that are helpful. Niacin is a vasodilator, natural vasodilator. In fact, it's part of the problem of taking niacin, because a lot of people want to take niacin to lower their cholesterol, and it works. It works decent. I mean, it's a pretty good drug for lowering cholesterol, except for it comes with a flush.
It does. It makes you super itchy, and it just
Maybe.
increases your
Not always.
metabolism. Well,
Sometimes.
Yeah.
Yeah, it can. Let me say that. It can. And you can use that side effect as a way to treat Raynaud's as well.
Okay.
Now, I wouldn't use niacin straight because the effect is real flushy. What I'd use is a kind of slow release niacin. It's called inositol hexaniacinate. I know it's a real mouthful, isn't it?
I'll remember it.
It's niacin mixed with inositol, and there's 6 of them, so that's why it's a hexaniacinate.
Okay.
It's like a wheel. The inositol sits in the center like a hub, and then the niacins come out on the sides. Yeah, more information than you needed, right?
Well, it's good
Well, there it
information
is.
to have. It'll be in the back of the brain.
There's another thing that I want to talk about that is often overlooked that is particularly helpful with this vasodilation thing, and that is getting more oxygen to your tissues. Okay? So the way we talked about oxygen before. We've had a show about this, but not everybody's seen all the shows we've done. So let me remind you. One of the most obvious ways to get oxygen into your body parts is to breathe, right? And so you breathe, right? In, out, in, out, in, out. Okay, so then you're oxygenated. It's not going to really mess with the reflex very well. So what you want to do to get the reflex to actually open up even more is you want to increase your carbon dioxide levels. Now that's different, because what you need to do for that one is you need to do deep breaths, and then hold your breath. Now, this is made famous by Wim Hof. And if y'all are interested in Wim Hof, you can look him up online. He's got a class he teaches, and he's
all
written
over
books.
the
He's all over the
internet
place. Yeah, he's
at
doing
this
all kinds of
point.
interesting things. So he taught me how to do this breathing technique. And so what you do is you breathe in deeply. Let me do it. Good. You breathe into your belly, into your chest, into your head. I know, who knew we had lungs on our head, right? Nonetheless, belly, chest, head, and then out. And just let the breath fall out. You're not forcing it out. So you're pulling it in with vigorosity and then letting it fall of its own accord. So you do 30 of these. And on the 30th one, it changes. You do this. You breathe in the same and out. And then you hold on the exhale. You hold your breath on the exhale at the bottom of the breath, which is counterintuitive. Whoever holds their breath on the exhale, nobody. It seems weird.
Yeah.
That's when you hold your breath. You hold your breath on the exhale, and you hold it for as long as you can. Now, what happens is your body's full of oxygen from all the breathing, and you also breathed out most of your carbon dioxide by doing these deep breaths. In fact, you have to be careful about doing this because it can make you lightheaded.
Sure.
It can make you kind of dizzy, and it's not an uncommon thing to do. You don't want to do this breathing pattern while you drive. Definitely not, right? Or while you're in a pool.
Of course.
Heaven forbid, right?
Right.
Yet when you breathe your air out, the way I imagine it is I'm breathing my air out and then I hold my breath and I go calm as if I had sunk to the bottom of the pool.
Sure.
In my mind, I'm sitting in the bottom of the pool on the deep end, just holding my breath, doing that Zen thing, and holding my breath as long as I possibly can. Now, when you do that, your carbon dioxide levels will build up because your body's making, stuff, and carbon dioxide comes as a byproduct of metabolism and builds up. So your carbon dioxide levels build and build and build and build and build, and you're flooding your body with carbon dioxide. Now, you think this would be bad because carbon dioxide, in with the good air and out with the bad air, but oh no, au contraire. The carbon dioxide is extremely useful because what it does is it causes the hemoglobin molecules, those are the molecules that carry oxygen, to release their oxygen. Now you think, well, do they need help doing that? And the answer is yes. In fact, they do. Because the way your body gets oxygen from the air into your cells, it has these little boxes called hemoglobin. They're tiny little boxes that have an atom of iron in the center of them. And the box keeps the iron safe so it doesn't ruin things because it's oxidative and creates all these oxidative chemicals and things like that. Anyways, aside, just say it needs to be boxed. So it takes these iron molecules, or the atoms specifically, over to the lungs. The oxygen jumps on of its own accord because it wants to be there. That's called rust.
Yeah.
So you throw a nail out in the yard and you don't have to do anything. It just rusts of its own accord. Just normal chemistry from the atmosphere. And so this hemoglobin will oxidize of its own accord, just normal chemistry from the atmosphere. Oxygen jumps on. Then it goes over to your cells in your knee or your toe, whatever, and then it jumps off. Except for jump off, why is it jumping off? It doesn't jump off, it's stuck. It's rusted. It's going to unrust?
No.
Yes.
Oh.
And the reason why is because the carbon dioxide attaches to the bottom of the molecule, causes the molecule to twist, and boop, pops the oxygen right off. That's the trick.
Into the extremities.
Yeah, into wherever they needs to be. Whatever the cell that happens to be near, the oxygen pops right off. And then it's ready for another trip. So there's a certain percentage of our hemoglobin that does not let its oxygen off. They go over to your knee, nothing jumps off, and it goes back for another trip. Now, you do the test, you're oxygenated, except for your body's actually not moving oxygen. It's just going back and forth, but it's not going anywhere. It's not jumping off. In order to get it to jump off, you need carbon dioxide.
Yeah.
Now, let's think about this a little bit more. Let's say you've been breathing a lot because you're nervous. And you blew all your carbon dioxide levels off.
And you're hyperventilating.
You've hyperventilated
Yeah.
your carbon dioxide. Now it's not working because
Sure.
it needs the carbon dioxide
So
for it to
that's
work.
why they have people breathe into a paper bag.
Yeah, because you go to the doctor, you're like, I'm having a heart attack.
I'm having a panic
You go to the
attack,
emergency
yeah.
room, they look you up and down, and they say, oh yeah, we've seen your type before. Here's a paper bag.
Right.
You put it on your face, you think, no, I need oxygen. You need to give me oxygen. You give them oxygen and they die. It has no effect on them.
Yeah.
You give them carbon dioxide, and now their hemoglobin starts releasing the oxygen, and they come back alive.
So for the last minute of our show, I'm sorry to abruptly interrupt. We're going to review the treatments we have
For Raynaud's.
for Raynaud's. Yes.
Okay, so what we want to do is we want to calm the immune system down, find the stuff that's irritating and get rid of it. That's infections and such. We talk about that on another show. We want to relax the blood vessels by taking magnesium, by taking quercetin, and I mentioned that before, by doing the arginine. By the way, nitroglycerin works too, but it gives you a high headache. Anyways, we want to relax blood vessels, okay? And then the main thing we want to do is we want to do hydrotherapy. And we want to retrain those the blood vessels to open and shut appropriately.
And the hydrotherapy is somewhat acting as a nervous system rehab.
Kind of, yeah, it really is. It's just getting the body to open up when it gets exposed to cold. And you're simply practicing until it gets the hang of it. And it takes, usually you're better within a day or two. Then really you get the real hang of it by about a week into it. I've had patients that did the hydrotherapy for a week and they were done, one and done. They didn't need more. And I have other ones that have to do it occasionally and kind of re-up it. They'll do 2 or 3 days and kind of retrain their body. Now those ones, clearly there's something else going on, so I have to run more tests and figure out what's happening. But once you get the immune system calmed down by doing all the other stuff, and then you do the training on their blood vessels, boop, they clear right up. Useful stuff, isn't it?
Very useful.
Worth listening to the show, particularly if you have Raynaud's.
All of this. We can do a recap show later and update everybody with the treatment.
All right. Thanks, Haley.
Thank you, Dr. Luper.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.